So let's start the call. So good afternoon, everyone. This call again is the third in the succession. We've been doing COVID calls since almost 10 months. We had almost everyone here since then. So we hope you all are maintaining proper social distancing and staying safe. So this call is being organized by Bharathi Foundation, and also Majji helped me a lot in organizing these things.
No worries.
So Bharathi Foundation brings you another episode of COVID-19 awareness session. Bharathi predominantly works on the cultural aspects of India, and it is always in the forefront for community service, like conducting yoga camps, meditation camps, and moral study camps to kids and elders in and around Frisco. So let me introduce the doctors on the panel today. Before that, Ram will introduce Rene and Bill. So welcome to the call, Rene and Bill. So we have Dr. Duggal, Anurag Duggal. We had him in the last call too, who is currently practicing on clinical infectious diseases. He moved from Cleveland, Ohio, and he has special interest in emerging infections and has earned accolades for teaching best clinical practices at various institutions. So he was also recognized as a Physician of the Year in Cleveland at Clinic Medina Hospital. So welcome, Dr. Duggal.
Thank you.
Come again. And we also have Renuka Basavaraju, a board-certified allergist, rheumatologist, and immunologist practicing in Irving and Frisco past 20 years. So she did her medicine from India, and she's an MD in general medicine, done residency in internal medicine from University of Virginia. She is practicing and also practiced internal medicine in South Carolina, Virginia, before she returned to Kansas University to pursue her dual fellowship in allergy and rheumatology. And we have Sunil Thummala, our neurologist, resident neurologist from Richwoods. So he has his own clinic in Frisco as well in Paris, Texas. So he'll be one of our hosts as well. You can ask questions to him also. So I'll just, we have Ram Majji, who has been long-term Frisco resident, working for Frisco, Frisco resident since long time. He was a chair in Indian Affairs Committee and also on various committees of Frisco City. Ram, I'll just hand over this to please introduce.
Yeah, thanks, Sreekanth. Appreciate it. And first of all, thanks for all the doctors taking like a lot of time to come in. And just a quick, so I am Ram Majji. I've been in Frisco for like 22 years now. And I'm just a social servant. But one thing I do want to highlight is I got lucky we do a lot of Salesforce projects. For the last year and a half, I was lucky to help the community, not only with our organization called Everyone Eats, but I was also helping the Washington, D.C. directly with the pandemic and also with the vaccination. So I do have a lot of knowledge in the last 1.5 years working with a lot of these epidemiologists and pandemists. But I want to make sure that I'm honored to introduce two of our council and also Frisco ISD Board of Trustees. So we have Bill Woodard, who is on the Frisco City Council, and also Rene Archambault. She is actually the Frisco ISD Board of Trustee, and she's the Vice President of the Frisco Board of Trustees. And I'll let them actually go and introduce. We can start with Rene and then Bill next, okay? Thank you.
Thank you. Thank you, Ram and Shree, for having us. We're so excited to be a part of your panel today. I'm Rene Archambault. I currently serve as the Vice President for the Frisco ISD Board of Trustees. I've been serving you since 2018 in that capacity.
Sorry, one second. Let me actually hear.
Rene.
Is that good? Am I unmuted?
Okay.
Can you all hear me okay?
Yeah.
Okay. So I've served you as the Frisco ISD School Board Vice President for the last year, and I've been on the board since 2018. Shree and Ram invited us to one of the first meetings that they offered for your community back in the spring when COVID was kind of just starting, and we didn't really know what we were going to be doing in Frisco ISD as far as virtual and in-person instruction. And so we came on and answered a lot of great questions from the communities of Richwood as well as Lexington. And so we're really happy to be here to answer any questions going forward about our COVID response and then the recovery that our district will go through over the next many years as we kind of move past the response phase and into recovery. So thank you all so much for having me.
Thanks, Rene. Bill, you can please go ahead, please. Thank you.
Right. First of all, thanks for having me on, everybody. I appreciate the opportunity to be here. I currently serve on Frisco City Council Place 4. I've been on City Council since the summer of 2016, and actually was on our Planning and Zoning Commission for 6 years before that, and a couple of boards and commissions even before that. So I've been involved with the City of Frisco now for well over 10 years. Have lived here for 16 years now, so I've seen a lot of changes in the city in that period of time. As Rene said, we've seen a lot of changes over the last year with the COVID response and what we've had to do on the city side of things as far as trying to balance the health and welfare of the community as well as supporting our small businesses and our business community. So look forward to having the discussion and letting you know everything that we've been trying to work on.
So Ram, so we'll let Anurag Duggal to say a few words.
You can take it.
Hi guys. I hope everyone can hear me. This is a very tough time for us in general, in infectious disease and in a medical community because of what's happened over the last year. And my goal today, I've been to the previous Zoom meetings and trying to educate the community about what we can do as a community to get over this pandemic. And the most important thing right now for us is to see if we can get the immunizations, the vaccines to everybody who is willing to take it. And from what I see from the initial response right now, it's been very, very good so far. So I'm looking forward to talking about all the vaccines and trying to help answer questions if there's any questions on the way.
Dr. Renuka, do you want to go ahead?
These are tough times, and we have some good questions, some tough questions from our patients because I'm an allergist and rheumatologist. We have people with immunosuppression who have questions, and regular patients who face general allergies. Should I take it? Should I not take it? What's going to happen if I take it? So if anybody has questions like that, I'm ready to take on those questions.
Sunil, Dr.
Hi. This is Dr. Sunil Thummala. I'm a neurologist. I practice predominantly outpatient neurology. So, but I share the similar sentiment of Dr. Duggal and Dr. Basavaraju. It's mostly about who should get vaccine, who should be prioritized, and should I take it or not, what to expect. So varieties of questions. I think I still get it through WhatsApp and people asking in the clinic and through WhatsApp. So I think this will help our community to get better from the experts. Thank you.
Yeah, Sunil, you can go ahead and.
Okay, so Dr. Duggal, I think let's start by just summarizing what has happened in the last 1 year. I think we spoke last time somewhere around May or June, something in that time frame. Just let us film what has happened since then in terms of progress regarding the infection statistics and also regarding vaccination. How did we reach there?
Yeah, so as you all know, when we first found out about the COVID-19, the cases when they started recognized in the US, it was in March of 2020, and after that we've seen a big rise in cases in the summer, and there was a big bump in hospitalizations all over the country, especially in certain states, which Florida and New York, California. In Texas, we were lucky that even though there were certain counties in Texas that were very heavily impacted, our Collin County in general, we were quote less affected than the other counties. I know Dallas County was affected really, really hard. But what we've noticed over the fall is that we've noticed that as we've become more and more receptive to the prevention strategies of masking and social distancing and trying to get around this pandemic, people are starting to get more educated. And because of that, we've seen a decrease in the cases over the last 3 to 4 weeks, I would say. And we are seeing that in the hospitals, because that's where I can really tell if we're making an impact, as if the number of patients who get admitted with COVID-19 in the hospitals is decreasing, which it has been actually. So that's a good sign, and we want to keep it going that way. The vaccination that has come through, and the enthusiasm for the vaccine by the community in general, because of I see the wait list everywhere, all the counties and all the places where the vaccine is available, the wait list is in thousands and tens of thousands. So that's a great sign for us. And I'm sure we're going to talk more about the details of the vaccines in general, but I like the trend that we're in right now. I want to keep it going this way. I don't want us to let up and stop doing what we're doing, because this is the only way to get over this pandemic, is to work together, do everything that we're doing, and then vaccinate as well.
Thanks, Dr. Duggal. Dr. Basavaraju, I think, in the clinic, you are seeing lots of patients, right, with the post-COVID status. And sometimes, patients probably don't tell you, they come and they are sneezing, coughing on you. So what do you tell these patients who probably are maybe symptomatic or not symptomatic? What precautions do you want to tell them? Dr. Basavaraju, I think
you are on mute, Renuka.
Okay, good.
Can you hear me now?
Yes.
Yeah. So if they're, generally we have a screening before they come to our clinic on daily basis. Did they already have an infection or not? Constantly, because we had an immunology clinic. So because 90% of our patients are immunosuppressed. So a week at a time, on daily basis, we have a screening questionnaire for them. Were you infected? Were you seen in the ER? So the people who are coming to us we don't realize that after having they come, they had a COVID infection. So if they tell us, yes, they had an infection, so within that 7 or 10 days, we don't let them come in, and we convert them into a televisit, so they don't come and infect our other patients who are already immunosuppressed. So that's a bit intense for the staff, but that has to be done, at least in our setup, in our kind of setup. That may not be done in another primary care physician setup, because not all of them are that immunosuppressed. But in our clinic setup, we have to constantly watch out so that if there is somebody who's done asymptomatic transmission, our patients won't get affected. But if that 7 days has passed, we are not that particular that we stop them from coming. If they don't run a fever, they're okay to come in. But if they're in a fever, we don't let them come in, because everybody gets a temperature screening when they come in. We don't do a COVID-19 test for them to enter the building, though. Understand that even if they're coming for an infusion, if they're infected, after the 10th day mark passes, if they need to get an immunosuppressive infusion of some sort, we let them come in. So it's kind of, it's a mixed bag. When they come in, we have to go by case basis of how we let them come in or let them mingle. But we have a lot of, we see only about 3 people in an hour's span in 3 rooms. So they're so separated apart that they have to wait in the car until we just let them come in. So we have a different way of working in our setup. It may be pretty different from other doctors' setup, where there are a lot of people are in the waiting room. In our waiting room, there's only 1 person at any given time.
Exactly.
Simply because everybody is immunosuppressed in our area, so.
Exactly. I think, in our clinic, we do the very similar thing because half of our patients are geriatrics patients. So we have to be careful with the geriatric patients, Parkinson's and, multiple sclerosis. They are also immunosuppressed to some degree. So we take very similar precautions. Nobody's sitting in the lobby for more than certain, 5 minutes or so. They're always in the room, and no 2 patients at the same time. So very simple. Obviously, I think this helped a lot, I think, to reduce the number of infections and to give comfort to the patient so that they can come to the clinic. Otherwise, last year, I think a lot of patients were hesitant to even come to doctor's office. They were sick at home, but they don't want to come to the office. So we have to do telemedicine, which in most of the cases is not that effective. especially if we can't see. Bandwidth is an issue, internet connectivity is an issue. So many logistical hurdles we faced. So moving forward, Dr. Duggal, obviously regarding this vaccination, big one now, should we consider this as a prevention, a cure? How should we think about this vaccination?
Yeah, the vaccination in general for any kind of infection is considered a prevention strategy, because our goal is to create this environment where many people in the community, if not all, have antibodies against the presumed infection that we're trying to vaccinate for. So it is a preventative thing. We're trying to prevent from people from getting severe infections, from being hospitalized, and hopefully from deaths. And that's the strategy behind any vaccination program for any pandemic. This one specifically, I think it's even more important because we don't know much about this COVID-19 virus. We don't have answers right now for everything. We're still learning about it. So I think it's very, very important for us to try whatever we can to prevent people from getting hospitalized from this infection. And we, on a daily basis, I see so many patients who are extremely sick, who are on the ventilator, and who don't have hope because we don't have too many treatment options either. We are very limited with that. So the best strategy is to prevent people from getting into the hospital. And that's where our focus is. And I believe this is the right focus for us.
Maybe from a city standpoint, if they want to update anything regarding the vaccine logistics.
Bill, you can go ahead, please. Yeah. City update.
Yeah, so part of the logistics that we face is we don't know when we're going to get another shipment of the vaccine. The vaccines are being distributed right now at the federal and then at the state level. So the city of Frisco, for instance, a couple of weeks ago, we had a vaccine distribution point at the Sears store down at the mall because that building wasn't being used and Sears had vacated it. So we were able to set that up, and we had around 8,000 vaccines that we were able to distribute during a 1-week period of time. Since then, we have not gotten another distribution of vaccines to the city. So that area is still set up. It's still ready to go. We're still prepared to staff it. So if we find out that we're going to get another shipment of doses in, then we're ready to immediately start up that distribution site again. And that's really kind of been the biggest challenge, I think, for most of the cities at this point is there's still a greater need for the vaccine than there are vaccines available. When we opened up, we knew we were going to have 8,000 doses, approximately 8,000. We had hundreds of thousands of people trying to sign up. So there's just so much more demand than there is availability right now. That's really where the challenges are. And so what I'm hopeful is as more of the vaccine becomes available, more distribution sites get set up, and we'll see a large increase in the distribution as time goes on. But right now, it's just a matter of demand far exceeds the supply that's available right now.
Dr. Duggal, I think we get the sense that some certain demand I think is far outpacing.
Sunil, question to Bill again. Bill, actually, by what date and time we can achieve total vaccination of residents of Frisco community?
I don't know that we have a specific date or time that we can tell you because, again, there's so little supply compared to the demand right now. It's going to be dependent on when more vaccine can be put out into the market.
And from the school district side, we're spending a lot of time right now advocating for our teachers and staff to be considered essential workers so that they can move up in their availability to receive the vaccine. So right now, teachers are not considered part of that 1B status. And so we're working with our legislators because our teachers are going into the classroom every day with our students for those that want to be vaccinated to be able to do so. So we're advocating right now as in the entirety of Texas public schools, trying to make sure that our teachers and staff move up in in that response, so that if they want to be vaccinated, that they can do that as in the same kind of space as our healthcare workers, because they're on our front lines every single day, and without them, our schools will close. And so we are that's something that FISD is working with state legislators on right now.
And Rene, I'm gonna just chime in real quick. I think that point is well taken. I've had so many teachers ask me this question, not only from here, but the people that I know in Cleveland, and they've asked me the same question. They're like, why are the teachers not in the 1B category?
Yeah.
They should be in the 1B category, if you ask my opinion. And there's no reason why not, because one, there are so many teachers who are, age-wise, they would be in that category. Number two, they are exposed to so many of these kids who we don't know right now how much transmission occurs in kids and what happens with them. So, and there's so many other workers in the schools, not only just teachers, but other workers who are also could be exposed and could be carrying the virus. So they should absolutely be in the 1B category. And I have no doubt that we need to do that. I think that is I'm very strongly in favor of that, is trying to vaccinate the teachers first before we open the schools up, because that's going to help with the kids in general too, because down the road we'll get vaccination for the kids as well. Right. So I think it's a very important point. I completely agree with that.
Yeah, thank you so much.
Dr. Duggal, I think extend that discussion, who should get vaccinated?
So right now, as far as the tiers that were created for prioritizing who needs to be vaccinated, number one was the healthcare workers and the frontline workers, who they wanted to target first because they are the ones who are exposed to the COVID most commonly. And number two was this high-risk group, the 1B, which they were talking about, age 65 and older, and anybody with chronic medical conditions such as chronic kidney disease, diabetes, COPD, asthma, any kind of lung disorders. Those would be considered the 1B. And then after that, the general public in general would come in where, anybody who doesn't have those risk factors, and they would be counted in that big group. So right now, what I see is the bottleneck of the 1B. Even 1B have not been fully vaccinated yet, and that's an issue, because as Bill was saying, that the vaccine supply is not very, very good right now. And I'm hoping with more and more vaccines coming in, that will be solved and more people can be vaccinated. And I see so much enthusiasm in the community. I cannot tell you how many times I get asked, when can I get my vaccine? And those are people who are not in the 1A or 1B. So we need to get the vaccine available for people, and the high-risk people should be able to get the vaccine first, and then we distribute it to the general community.
Yeah, I think, I have patients who are like 90, 80 years of age, and they claim that they are not able to get the vaccine. But I hear on Facebook, like, a 40-year-old person posting that he got vaccine. It just bothers me that a vulnerable person is not able to get it. So I'm not sure how the logistics are. I'm specifically talking about, in Paris area where I practice, patients, can I get vaccine? I requested supply for our clinic. We haven't received any supply yet. I don't know when we will get it, but a lot of our patients are, 70s, 80s, 90s with multiple chronic medical problems, which I think are very vulnerable population where the benefit really is there. So should, average healthy individual, younger person, stay put for now and let elders and people with common chronic conditions take? Is there anything like that in the logistical side or in the prioritization that we have right now? I don't know whether city does any prioritization like that.
So yeah, we make anybody that signs up to get the vaccine, they have to certify that they fall into that 1A or 1B category at this point. Because of a variety of different things, just the amount of personnel time and things that it would take, that is a self-certification process. So if somebody says, I fall into the 1B category, we trust that they fall into the 1B category. We don't have any way logistically of validating that, there might be a chronic disease or whatever the other issue is, not to mention the privacy issues that I know all the doctors are aware of. So we do state that it's, you've got to be in the 1A, 1B category, but at the end of the day, it's up to that individual to tell us the truth and certify that they fall into that. There's just not logistically a way we could do anything other than that with the demand as high as it is right now.
Quick question for Rene, because I think I just want to make sure that this is covered. So Frisco ISD, we have almost 70 plus campuses, and most of our kids, either we have people, kids going on site or kids remote. So from your perspective, how are the cases, especially in the students of Frisco ISD?
So as of right now, and I checked on our numbers on Friday in preparation for this call, we have 53% of our students that are in person, 47% that are online out of a district of 64,000. So we're almost dead split between the two modalities of education. Our case count definitely spiked after Thanksgiving. Well, Halloween, Thanksgiving, and then when we were on break, we had quite a spike during winter break. And so now the case counts are starting to come down a bit. What we have seen, though, is that the areas that we have the highest incidence of COVID are in areas where students are not masked. So we are not masking students in K through 2. We're not masking students during most athletic events. And so over 60% of our cases in Frisco are in pre-K through 2nd grade and then within athletics. When our students are masked, this virus is not spreading amongst from peer to peer or from peer to teacher. So social distancing and masking works, and it's been working for Frisco ISD since we opened our campuses in September. We have seen, we've had great community support with these mitigation protocols that are put into place by our fabulous physicians, like the 3 that are on this call right now. We listen to them. They're the scientists. They're the ones that are telling us, here's what works, and that's what we're doing. And so we've been very pleased with the community and with our students and with our teachers for following this protocol. I mean, before the vaccine, all we had was masking and social distancing. I mean, that was the best, those are the best 2 tools that we had. And so Frisco ISD has worked really hard to enforce those mitigation protocols since we opened. And we've been very fortunate that since we opened our campuses in September, we've not had to close one of our schools. Out of 72 campuses, we've been able to keep all of them open. And so that just goes to the effectiveness of those 2 mitigation protocols. So we've been very, very fortunate that the community has sort of worked arm in arm with us to keep these campuses open and to follow the rules. So far, we've been very pleased.
I think we can actually divert that same question to Bill. Bill, I know that from the last, probably like January, right? I know you all were having that COVID sessions, and I was there, and the whole COVID was kind of going up. So how are the cases, especially the positive cases within the city of Frisco? That is my first question. And then just to connect to that, is the data coming in from Texas HHS, is that actually helpful for you all?
Right. So yeah, one of the things that we did a few months ago is, quite a few months ago now, it's probably been 6 months or better. Rather than going off of a positivity rate or something else, we switched over to looking at the hospitalization rates. There was a lot of challenges with the state level data about people being double reported as being positive or not getting reported. I think if y'all remember over the summer, there was this massive increase because there was such a backlog at the state level. And we had quite a few of our IT staff, working with the counties, because one of the challenges that Frisco has is we're almost dead split between Denton County and Collin County. So it's not like some cities that might just have a little sliver of their city that goes over into another county. Since we are almost half and half, we have to work with both counties, and we had 2 counties doing completely different things. So we had our IT staff working with both counties as well as the state, trying to scrub the data, and it just got to be where we didn't have confidence in the accuracy of positivity rates or other things. So we switched to watching the hospitalization rates because those numbers were far more accurate coming directly from the hospitals as to how many beds were in use and things of that sort. One of the things that the governor had put into place is, there was some more stringent criteria if we're over a 15% hospitalization rate. And we've been over 15% for a couple of months, but in the last week, that has actually dropped down below 15%. And I think right now, as of last night, I'm looking at it, our hospitalization rate for our area of Texas is down to about 13%, a little over 13%. So we've been using that metric to help guide us in the openings and closings of restaurants and other businesses. And if we hit a 7-day average below 15%, it allows some of those businesses a little more flexibility. And then from our standpoint, what we've tried to do internally with our city staff is to find best practices and then go out and share all of those best practices with the business community. It's amazing how well some of our businesses immediately adapted to the pandemic back in March. And some of the processes and procedures they came up with, we were able to take those and share them around with other businesses of similar types, which has really helped people stay open. And from our standpoint, we're trying to balance the health and safety of the public, but also the fact that those businesses, support people. They support our residents. People are working there and getting paid from there, and there's a mental health aspect that we're dealing with. So there's a lot of different things that we look at that we're trying to balance. But it's been primarily the hospitalization rates that we've been using for the last, like I said, 6 or 7 months, I think.
And I'll say from the school district side as well, something that we deployed when we opened our campuses, we have teams of folks throughout the district that work on contact tracing. And so whenever we have a case on campus, or even a case with one of our virtual students, if we cannot identify their entire kind of sphere of influence, any sort of contact tracing within 2 days, that's when we start shutting down campuses. And so our ability to contact trace thousands of cases over the course of the last 7 months, it speaks to the true testament of these really amazing campus teams that are looking to go through their, all of our students sort of cohort and figure out who do they sit with at lunch, who are they playing with on the playground, who's sitting next to them within 6 feet in a classroom if social distancing isn't quite possible because of the size of the class. And so these teams have been able to do that effectively to the point that we've not ever had to shut down a campus. And so I really want to speak to their effectiveness as well, because they've done an incredible job for Frisco ISD.
And I should add, from the city side of things, our operations are a little bit different than the school district. Obviously, Rene and the school district staff are looking at all the students and what have you. On the city side of things, we've got all of our first responders that we're dealing with, and you can't just shut down the city because of the services that we provide. So we've done a lot of work internally with the staff to make sure that there's protocols in place and that our staff is protected as much as possible from the virus. Because of the forethought that especially our police and fire department had, we've never run short on masks or personal protective equipment for any of our first responders. We've always had enough on hand. The way our first responders had to respond to incidents completely changed last March in having to go out in personal protective equipment that wasn't quite as intensive prior to the pandemic. So our staff on the city side has done a great job also with keeping our staff safe, as well as those interactions that they have with the public safe as well.
Excellent.
Dr. Sunil, you can take up medical questions.
Yeah. Dr. Duggal, I think, going forwards with this vaccination, let us say, someone it qualifies that they want to get vaccination. What are the things they should consider? Because there are a lot of myths going on. Which is better? What are the complications? Can you just summarize to us?
Sure. So right now in the US, there's 3 vaccinations, well, 2 vaccinations that have been FDA approved, and Johnson & Johnson is trying to get the FDA approval for their vaccination as well. But Pfizer and Moderna have been approved for vaccinating people for COVID-19. And I'm going to quickly summarize what they are. Both of these Pfizer and Moderna vaccines are mRNA vaccines, which basically means it's a little nuclear, it's a messenger. Basically, it's a nuclear material that encodes that same protein that the virus uses to attach to the human cells. So it encodes for that, but it does not get incorporated into your own DNA. So that's a very important point, because people are like, oh, if I take this vaccine, it's going to change my DNA structure or whatever. So that's not true, because this mRNA is considered to be just a messenger which gets to where the assembly is occurring for the protein, makes the protein develop in the human cell, and then that mRNA is destroyed by the human body. So it's not retained in there for years or years. So that mRNA helps with that. So that is the whole concept of this mRNA vaccine. And what we see with the vaccination effectiveness is both Pfizer and Moderna, they have been 94 to 95% effective in preventing mild disease. Mild disease is when you don't have too many symptoms. It's just like the sniffles. You have low-grade fevers or some muscle pain, and you don't need hospitalization, and you don't have any drop in your pulse ox. That's considered mild disease. Now, both Pfizer and Moderna have been 100% effective against severe disease, which means, severe disease definition is you get your pulse ox drops to the levels where you need to either be on oxygen or you need to be hospitalized. And both these vaccinations are 100% effective in preventing hospitalization and deaths as well. So their data is very, very good as far as what they can do. And I would say these two vaccines have been the most promising that I've seen. And then whatever data we've seen out of Johnson & Johnson, it's also very good. It's a one-time dose instead of the 2 doses that you get for Pfizer and Moderna. The Johnson & Johnson is a 1 dose. And it's a slightly different mechanism of action, and I won't go into the details of that. But they basically use this beaten up virus called the adenovirus, and they use that virus to transport the signal to our body to produce the same spike proteins that the antibodies react against, and then we develop the protection by the neutralizing antibodies in our body. Again, to make things clear, there's 2 doses for both Pfizer and Moderna. With Pfizer, you get the 1 dose on day 1, and then you get the second dose at 21 days. With Moderna, you get the 1 dose at day 1 and the second dose at 28 days. So there's a little difference in the timeline, but their effect is pretty much the same. After both these shots, the 1 shot of both of these vaccines, in about 10 to 14 days, you should develop about 60 to 65% antibodies, protective antibodies, even after the 1 shot. So that's good. But that doesn't mean you stop doing what you're doing and stop wearing a mask, because you can still transmit the virus. Even after the second dose, you can still transmit the virus to people who haven't had the vaccine. So that is very important for people to understand that you can still transmit the virus even after you get vaccinated. You yourself may not develop any severe symptoms, but you will still definitely be able to transmit the virus. So we still need to mask up. We still need to do what we're doing with social distancing. And we still need to wash our hands before we do anything or touch our noses or ears and whatnot. So that needs to be driven home. Very, very important point. Johnson & Johnson is a 1 shot, and it is not, the data shows 72% effectiveness against severe disease. Against mild disease, and against severe disease, it's pretty good. So the 1 shot helps because the 1 shot means you don't have to bring the person back for another vaccination dose. And if you're 1 and done, you can use that for maybe larger community, or different groups, subgroups, for example, college kids, younger individuals who you may have to worry about getting compliance, coming back for getting their second dose, or, in other settings. So I think in general, your vaccination strategies that are available for the 3 vaccines that will be available to us are making sure everybody gets vaccinated who is in the high risk group. So 1A, 1B goes first, and then if there's more vaccine available, then others get it. And then once you get the vaccine, you need to know there is no real contraindication before you get the vaccine, by the way. Most commonly, the contraindication is and it says on the Pfizer and Moderna website, is that if you have a hypersensitivity or a severe allergic reaction to one of the components that they have in the vaccine. And you can look it up. It's nothing major. They don't use anything that is very common. Unless it's a very rare thing that you're allergic to, and that's the one thing that they use in the vaccine preparation. Most of the people are okay. There's no real severe contraindications to getting the vaccines. So anybody who has these risk factors should be able to get the vaccine.
Dr. Duggal, one question there are some few countries in the world where the COVID situation is completely not effective anymore. Like in India, nobody is wearing mask or maintaining the social distance. They have all the events scheduled. They're participating in that, but still the effect isn't there at all. What is the reason that still here it is being considered so threatening and not in India?
I think, Sri, I think the important point is that reporting and data collection is very important. In India, we know that, out of the 10 cases that are reported for COVID, there is another 2,000 that are not reported. So I think reporting is very important, and collecting all that is very important for us in the settings where we are able to get all this information in, especially in the US. And with all the media coverage and all that, you can sense that, there's a lot more bright lights on the US because of the way they are. But I'm telling you, it's not that, it doesn't happen in any of the other countries. But obviously, with, I don't know if there's other exposure to other COVID viruses in India, that people are more prone to developing cross immunity to COVID-19. I don't know if that's the case. But I know for sure that there's underreporting in India, for sure. I know that.
That is there, but I just came back from India Jan 10th. I lived there for 2 months.
Mm-hmm.
I've seen people wearing no mask and everything, but I did not see any deaths in the area that I was living. Is there any rate difference? Like there is a different rate down there to compare to US?
I'm not sure. I'm not sure if there's a genetic trait or something that would make it less likely for people of Asian origin to not get severe illness of Indian origin. But, I'm not aware of anything like that.
Dr. Renuka, do you have any thoughts on this?
There is some kind of study which is going on now to find out why the death rate of COVID-19 has slowed down in India. There is some focus on the alpha-1 antitrypsin molecule. So the data is not out yet. So there is most hypothesis. We don't know that yet. So at least for now, a couple of weeks ago, CDC had India as the destination 4 site. So each country destination level of severity. So a couple of weeks ago, or at least 3 weeks ago, India was destination 4 site, which means COVID-19 risk is very high. They dropped the destination 4 status to destination 2 status just about a week ago, which means moderate severity. So they just dropped that because the death rate has gone down. So every time the death rate goes down, they drop that from destination 4 to destination 2 for travel precautions. So why they have done that is just because the numbers have dropped. Their death rate has gone down. So they're focusing a lot on the alpha-1 antitrypsin. So we don't know what the connection between alpha-1 antitrypsin expression and penetrance of the COVID virus is. That's where most focus is working on in immunology. So maybe there is something will come out in the near future. We don't know that.
One of my friend is a scientist in Novartis. He was saying that there is a different protein in Indian genes that actually is preventing COVID from taking over.
That's the alpha-1 antitrypsin, which is in the respiratory tract.
Oh.
So we don't know whether that's how is it more expressed, less expressed, or is it conferring protection to the Asian subpopulation? We don't know that yet.
Oh.
There's a lot of hypothesis, really.
Quick question for, just to divert a little bit on this. Quick question for Rene from Frisco ISD. And Bill, you can take that next. I know from the city perspective, we work with our Department of Health. So from ISD perspective, how are you working with Department of Health? Is there a Department of Health for ISD?
We're working with, we're governed by a few different agencies. We have the county health agencies that we work with, as well as the TEA and the governor's office that work with the CDC and state level, health authorities. So we have 4 or 5 different agencies that help to govern the decisions that we make. When the counties started doing different things, because like Bill mentioned, Frisco ISD is also split between Collin and Denton County. And so when the county started doing different things and started reporting their data differently, Collin stopped reporting for a little while and Denton was still reporting. So when all of that was happening in the fall, we started looking at our own data and making our decisions based on Frisco ISD data only, because it was the most accurate and it was something that we had in real time so that we could make those decisions quickly as to how we worked on our campuses rather than waiting for the county health officials that were sometimes reporting, once a week, sometimes reporting once every 2. We couldn't wait on that data to make decisions for our students and teachers. And so we started monitoring and really doing a deeper dive into our own campus level data. And we've been utilizing our campus level data ever since the fall to make those decisions. So we're still governed by health authorities outside of our own district, but the data within our district is the best data that we have for our community. And so that's what we have started going on starting back in the fall.
And
yeah, Bill, go ahead, please.
the city staff works with the same agencies that Rene mentioned. They're on at least weekly calls with regional people and state level people, CDC and all these different organizations. And a lot of that is information sharing that they're doing and best practices and things of that sort. From the city side of things, once we got the processes and procedures into place to help protect the city staff and the interactions with the population, then like I said, our focus is a little bit different than the school district side of things, because those processes we have in place to protect the city staff really don't change a whole lot. That EMS or that firefighter that may be going out and interacting with an individual that could be COVID positive, that procedure hasn't changed much since March. There's just not a lot for it to change. But we do share the best practices and whatnot with all those same agencies, and we do make adjustments. It is a regular phone call that happens with our first responders and our senior staff with those agencies, and then council gets an update on any changes or anything that's going. Typically at every council meeting during exec session, we'll have an update on some of that information. And then obviously, if there's an important update in between, we'll get notified of that too. But regular updates are during our council meetings.
So going to the next question, Dr. Duggal, I think this is not a live vaccine, so any immunosuppressed patient can get it, I guess, right?
Correct.
Right. Okay. I think that was one of the questions. So how about, let us say, I got sick and I went to ER and I got tested for antibodies. Antibodies are positive. Should I still get the vaccine because I already have antibodies?
Yes. So that's a very good question. And I get asked this question a lot. People who've been infected before. And, there's a little difference in people who know when they had the infection versus people who just have positive antibodies. So if you know that you had the infection recently, let's say 2 weeks ago, and then they ask me a question, if there's a healthcare worker, they ask me, can I get the vaccine now? I usually tell them, because based on what we were recommending from the point that the vaccine is not readily available for everybody, if you've had the infection, you should have enough neutralizing antibodies for at least 90 days. So 3 months at least, you should be okay. But after that, your immunity starts waning and you definitely need to be vaccinated, especially if you're a healthcare worker. Now, if you ask me that question, that if someone has a positive antibody test, we don't know when their infection was. What if the infection was 3 months ago? They definitely need to be vaccinated because they could be weaning at any moment. So that's the little difference in the timeline. And if the one thing is, if your immune system is suppressed, let's say you're taking prednisone or if you're taking other immunosuppressants, in those situations, even if you had the infection, it doesn't matter. You still need to get vaccination because you need to develop your neutralizing antibodies as high as possible. And the vaccine will definitely help with that.
Dr. Basavaraju, what is your recommendation to patients who are on immunomodulatory medications, especially immunosuppressive? Like, do you ask them to hold the medication and then ask them to get vaccine?
Okay, so we have new guidelines for all the biologics and immunosuppressants, which was released just a week ago. We don't hold any immunomodulators except methotrexate and JAK inhibitors. JAK inhibitors are Xeljanz and Rinvoq. This is a new medication for rheumatoid arthritis. These two medicines we hold a week prior to and a week after the COVID vaccine 1 and 2. All other immunosuppressives, including the injectables, they continue to take their medications, with the exception of the two I mentioned. all the injectables, Humira and whatever, all the injectables, all the medicines for multiple sclerosis, IVIG, all of them have to be continued. There's no stopping. The only two we stop 1 week prior to 1 week after will be methotrexate and the JAK inhibitors. So these are the guidelines which were released a week ago. So we kind of keep our patients updated. We send out mass emails, say if you're on this medicine and you're already lined up for your vaccine, please let us know which medicine you're taking. So this is how we do it. If they're on prednisone, we want them to lower their prednisone to as low as 10 milligrams for that 1 week. If it is absolutely necessary, sometimes we just initiated them on 40 and they've got high disease activity. We have no option. Then we lower them to 20 milligrams, let them take the vaccine during that period for the whole month, and then up the vaccine. So one of the questions we generally get is, what if I have to get another vaccine? I have to go get shingles vaccine, pneumonia vaccine. Can I get it on the same day? This is a question we often get from patients. We usually want at least a week's gap other vaccines between the COVID-19 vaccine and your pneumonia vaccine. At least sometimes I give them a 2-week vaccine gap. But if it is absolutely necessary, you went and got a wound that day, okay, and you have to get a tetanus vaccine, then probably there is no other option. You got your COVID-19 in the morning, and within 24 hours, you can get your tetanus vaccine. But if things can wait, I want to get my shingles vaccine, that can wait for at least a week. What if you want to get an allergy shot? You got your COVID-19 vaccine in the morning, and you're getting your maintenance allergy shot. You can always wait for 24 hours later, because what if you get a reaction with COVID-19? I wouldn't know whether you got a reaction with this or that. So things which can electively wait possibly should wait, whether you're getting a routine vaccination, a routine shot of something else that can wait for 24 hours or a week, unless it's an absolute emergency that should wait. So that we don't get confused between this vaccination just to look out for a vaccination reaction.
How about NSAIDs? Should we hold off NSAIDs after
That's a
vaccination?
good question. See, in the very beginning, when the vaccine rollout happened, I think we routinely told everybody, go ahead, take a couple of Tylenol so that you don't get a reaction. And then some of the immunologists came out and said, hey, don't do that because it impairs antibody response. Absolutely, there's no data which says it impairs antibody response. Only thing is, it may just tell you that it may blunt the antibody response. It's not that if you take an NSAID, you're going to get zero antibodies. It may blunt it. If your reactions last a whole week, somebody gets a fever for a whole week, I would say, okay, go ahead and take it. But if it's 24 hours, I think they can tolerate a 24-hour fever. I would say just hold off, don't take an NSAID. But if somebody can't tolerate a whole week's worth of fever, joint pains, lymph node pain, they could just take it, but that's not going to affect their antibody response.
How about Dr. Duggal? Obviously it's not approved in pregnant women yet and children below 16 yet, right? So how about if they have immunocompromised condition or vulnerable condition? Are there any exceptions for them at this time?
I think that depends on each individual case. And this question has been brought up. By the way, Pfizer and Moderna both are in evaluating their vaccine for 6 to 16 years old now in that age group to see if that vaccine will be effective. And the data should be out in the next few months. So that's one. Number two, for pregnancy, again, there is no real data. And again, they're also looking at pregnancy in their subset of patients, or they're trying to enroll more patients to do that. The point is that with pregnancy, I see a lot more pushback, and it depends on the individual. Since there is no concrete recommendation, I cannot tell anybody to get the vaccine if they're pregnant. But we look at the pros and cons, and the pro of getting the vaccination versus the cons of pregnancy and COVID. And I have seen severe cases of pregnancy with COVID who had to have the baby delivered much earlier and other complications. So obviously, when you see that and when you talk about that, then the OB doctors discuss that with the patient individually and let them decide what is the right step. And if they ask my opinion, I say, I would say even Dr. Fauci recently came out and they had asked him the same question about pregnancy, and he had said he would probably would recommend getting the vaccine for the pregnancy state because of the fact that the risks are so high with getting the infection itself. But the data is not up.
Dr. Duggal, I think, we have 500,000 deaths so far in the country and much more over the world. Is there any data showing that what type of patients are actually dying? So that way, these patients can get prioritized. Again, this always wondered, patients ask me, will I die if I get vaccine? If not, I don't want vaccine. If it is just sickness, I'll just stay at home. But if there is a risk of death, then I will take the vaccine. A lot of my patients don't want vaccine when specifically initially we started. Right now they are a little bit open.
Yeah, I hear you. I think that's a great question. So right now there is no data on what group of patients or what subgroup of patients would be high risk for getting severe illness and dying from it. We have seen, in general, 65 and older would be the highest risk because their immunity wanes as you age, so they're not able to mount a good immune response to any infection, especially COVID, which we don't know much about. And secondly, I think if you have concomitant chronic medical conditions, like I mentioned, with diabetes, with hypertension, uncontrolled hypertension, coronary artery disease, if you have COPD, if you have asthma, any other chronic lung disease, those are the patients that would be higher risk. And if you have multiple things in the same patient, that is even higher risk. So those are the patients I would say focus on first, who maybe if someone is your patient who has multiple risk factors like that, those are the patients who I would say, yes, you have a high risk of getting a complication or severe disease. So you are the ones who more likely need the vaccine right away.
Thank you. Quick question for Frisco ISD. I was texting Dr. Sunil on this. Rene, I think one of the things, my son is doing wrestling with with the independence, right? So what are the guidelines and the rules, especially if somebody is tested positive and also if somebody has an exposure to the positive cases?
So if a student or staff member tests positive, they immediately go into quarantine, and then we contact trace everyone that was sort of in their sphere of influence to see if they were masked, if social distancing was able to be followed, and then once we contact trace those that are around a positive case, then those students or staff members will also quarantine for 10 days. And they're able to come back to school after that 10-day period. We like to see that they have a negative test before they come back, just so that we can make sure that they're not actively infected. The biggest thing that we've seen with contact tracing is that if both students were masked, that transmission rate is very low. And so we've only seen around 1.5% of our quarantine students that were around a positive case actually test positive for COVID. And so that transmission rate is incredibly low when those mitigation procedures are in place and protocols are being followed. So kind of like I mentioned earlier, especially with wrestling, I mean, if students are unmasked, it's very easy for this virus to spread. And so we're seeing a higher incidence rate of spread amongst our athletes, for sure, because they're not always masked during their athletic activities. So that quarantine period is important to help stop the spread of this virus. But once we are able to identify the students, and we rely on parents to report back, we can only work with the data that we're given. And so if parents are not testing their students, if they're not reporting to the campuses that there is an active case, then it really limits our ability to stop the spread. So we really rely on that community partnership to be able to stop the spread of COVID-19. And so far, I mean, our families have been working with us in partnership to be able to do that. So we encourage testing, we encourage reporting that data so that we can continue to keep all of our campuses open.
Perfect, thank you. A quick question on that same note for the city side, right? So for Bill, so if there is a positive case, what are the quarantine guidelines for especially the city employees? Because we have a lot of city employees. Mm-hmm. So how does it work from a quarantine perspective? Yeah.
It's the same way that Rene mentioned. The difference is that we're dealing with primarily just our employees at that case. We've taken a lot of precautions to limit interactions with, for instance, our firefighters and the public as much as possible. It used to be that we would host birthday parties for kids at the fire stations. We're not doing those anymore because we need those firefighters and paramedics to not have an opportunity to even be exposed. Frankly, small things like, the restrooms at the firehouses used to be open to the public for emergency cases, and we don't do that anymore either. So a lot of the processes and procedures the city's put in place is to help limit the exposure of our staff to the general population. When those first responders do come into contact with personnel, let's say, somebody calls 911 and needs somebody to come out to their house, there's very defined processes and procedures for those first responders to go through, and personal protective equipment and whatnot. In the event that one of our first responders does test positive, they're quarantined for that same 10 days, and they need to have a negative test before they can come back to work. And we have had, some of our first responders test positive over the last year. I mean, it's just a fact. So it can become challenging if you end up with several people that are out sick for something like that. But, credit to our staff that we've managed to fill all those gaps when we've needed to, and the health and safety of the city as a whole has not been affected by it. It just makes the logistics a little bit more challenging in some respects. If anybody's been up to City Hall, we have somebody there at City Hall now that is really monitoring anybody that comes in and out of there, making sure that they have actual legitimate business there. So we've taken a lot of precautions just to, reduce the general population spread amongst the city staff.
Quick follow-up on that, right? Just to continue that quickly. Is city doing anything to control the spread? Like not just from a city employees perspective, but overall city perspective?
We encourage everybody to wear masks, wash their hands, social distance, just like, the school district does within the schools. We're still encouraging all of that. As I mentioned earlier, when you go into certain businesses, we've shared best practices with cleaning and how to operate to help reduce the spread. Just a small example, most restaurants nowadays, they don't put condiments on the table anymore. If you want something, you have to ask for it, and it's, they bring it separately, versus leaving stuff on the tables that you might touch and then I might touch, and things of that sort that would create spread. So we've worked very in depth with all of our businesses throughout town on those best practices on how to clean, how to prevent the spread within those businesses, which has been a big part of what the city's done. Because there are places like grocery stores or other businesses that people have to go to. You can't just stop going out altogether. So our focus has been on those best practices.
Go ahead, Dr. Sunil. Yeah. You're on mute.
Oh, you're on
So,
mute.
yeah. So sorry, every time there is a small scratch, I think, it is showing my picture there. So that's why.
No worries.
Okay. So Dr. Duggal, I think these new strains are coming. The question always we are seeing on the Facebook now, is this vaccine going to be effective for these new strains? Are there going to be new vaccines, again, boosters in fall? A lot of questions surrounding the effectiveness against these new strains, which are supposed to be more prevalent in the next few months or so.
Yes, Sunil, I think that's a great point. So I had mentioned before, Pfizer and Moderna, and Johnson & Johnson, which is hopefully going to get FDA authorization soon. So the new strains that we're looking at are three different strains that are in attention right now. One is the UK strain, which is the B117 strain. And the second one is a South African strain, which is a B1351 strain. And then the third one is a Brazil strain, which is a P1 strain. So all these strains are more infectious than the original COVID-19 SARS-CoV-2 viral strain. And why they're more infectious, I think there's a change in the spike protein structure, and that's why they're able to evade, the antibodies that are present in somebody. So they're able to bind tightly. They're able to bind tightly to the human cells, and that's why they're able to cause more symptoms. So these vaccines, both Pfizer and Moderna have tested their vaccines in the lab against the UK strain because they were obviously not available at the time when these trials were going on. So they saw that they were 100% effective in neutralizing the UK strain for both Pfizer and Moderna. For the South African strain, their data, they didn't provide an exact number, but they did say that the decrease in the virus in vitro in the lab was significant enough with both Pfizer and Moderna that it should not cause any severe disease in people who've had Pfizer and Moderna. I'm talking about the South African strain. And for the Brazil strain, there's no data for both Pfizer and Moderna because it's so early on right now. For Johnson & Johnson, in contrast, the UK strain is about 85% covered by the vaccine. And then the South African strain, Johnson & Johnson, is 57 to 60%. So it's still effective, but not as effective as they thought against the UK strain. But any vaccine is good right now. So that's the bottom line. All of these vaccines have been 100% effective in preventing hospitalizations and deaths, preventing severe disease. Any of these vaccines, if you're able to get those, you should get those. That's the bottom line right now. As far as boosters coming up in the summer, it depends. It depends on what we get more, as it's a real-time situation. It changes all the time. We get more information. If both Pfizer and Moderna have to tweak their vaccine to give a booster to the community because of one strain being more predominant, and they want to make sure that everybody is safe, they might do that in the summer. But we don't know that right now.
So do we have any vaccination? How long it's going to stay? I mean, how long these shots are effective?
Yeah, that's another good question. So when these vaccines were taken out, when they were being studied, they did not, in those studies, they were not able to tell how long the effectiveness will last. But with what they're able to project with the computer models, what they're able to see is that with the second shot, which is very important. So in both Pfizer and Moderna, the second shot is extremely important in boosting your immunity to 95% against mild illness, which means your antibody is going to hyperdrive. They should be able to hopefully last for 8 to 12 months. That's the goal. And the hope is that it's going to be an annual vaccine kind of situation where we get like the flu vaccine and we get a booster for the COVID every year. But again, this situation could change. As they get more information out, both Pfizer and Moderna could come out with data and the CDC may recommend something else. So this is ever evolving right now.
So those asymptomatic patients, they don't have to take a vaccine, right? I mean, they do have to, or they don't need to?
They do. So I think down the road, our goal is to make sure that as many people in the community as can get the vaccine, we should aim for that. That's the goal. Why? Because if you are able to get to, let's say, right now the US is about 10 to 12% as far as vaccination is concerned. If you're able to get to 60 to 70% in the country, then you can talk about this concept called herd immunity, which is basically you are trying to cover up the people who are not vaccinated by the people who are vaccinated around them. So then they don't get any severe illness. So that's what you're trying to achieve. But it's easier said than done. You see how much resistance there is in people who even want to get one shot. We talked about the questions that we get asked all the time. So I think I think if we get to that point, it's great. But our message to everybody is, if there's a vaccine available, you should get it. That's the message.
A quick question for Frisco ISD. This is, I think, parents and the kids, right? Are they going to conduct STAR test this year? If yes, when and why?
Yeah, the why is the most important part. I was talking to someone the other day about this, and I kind of likened it to someone asking you if you'd like to run a marathon with them without any training. And normally you don't run a marathon without training. And doing the STAR test this year is basically like asking students to do something and teachers to do something that they haven't trained for the entirety of this year like they normally do. And so we wish that they would cancel STAR for this year. We've been advocating for that. We certainly believe in assessing where our students are. We know that there's been a loss in academic progress and achievement throughout COVID-19. But the punitive measures and the high stakes testing that STAR employs, there are certain grades, 5th, 8th, and 12th, that if you don't pass STAR, you don't advance to the next grade, you don't graduate from high school. And so we want the assessment piece, but we don't want the punitive measure that goes into place for some of the testing. And some of those punitive measures have already been removed from STAR for this year, but there are still some in play that we are really advocating to be removed. So as of right now, STAR is happening. It is happening on campus. And so as of right now, the TEA, they're our governing agency at the state level. They are requiring all students that are going to take the exam to come into a campus. And so we have almost 30,000 students that are still learning online. And so how we get them onto a campus safely, how we, work with their families that have not felt comfortable sending them to our campuses all year long, to work with them to get them, onto a campus. Those are all big challenges. Mike Morath, who is our commissioner of the TEA, he said this week that online students, if they choose not to show up to a campus to take the exam, they just won't be counted in that data. So my guess is, while it's not a true opt-out for virtual students, I think a lot of parents are going to go in the direction of probably not bringing their kids to campus to take the exam. And so then we don't have good data. We need good data in medicine. We also need good data in education. And so if we have half of our district that has not taken this assessment, then we really don't know where we are as a district. So we're hopeful, and we're advocating alongside a lot of our state legislators to have a STAR waiver for this year. At this point, I don't feel really good about it. I think we're probably going to still have to facilitate that exam, but please advocate with your state legislators to continue to push the TEA to cancel STAR for this year. It really is. It's better for our students and teachers if we can do some formative assessments as we get closer to, throughout the spring and as we get closer to the end of the year, to really get a true assessment of where our students are academically. The STAR test is not going to really give us the data that we need to be able to make good decisions. So to answer your long story short, yes, the STAR exam is still in play. We wish that it were not.
Perfect. Thank you. Quick question for Bill, just to kind of get the. So Bill, I know that city has proved that they can scale, right? Especially for mass testing. So when time comes for mass vaccination, are we ready for mass vaccination also?
Yeah, so, we've got the one location set up right now. That's ready to reopen as soon as we have more vaccine distributed to us. We can scale that up somewhat, and we'll be prepared to do that if, more vaccines become available. There will come a point where we can only do so much, and we're going to have to rely on some of the private sector as well, like some of the pharmacies and the doctor's offices and clinics of that sort. And that's simply a logistical problem. There's literally millions of people in the Dallas-Fort Worth area that want to get vaccinated. There's 200,000 residents of Frisco. The overwhelming majority want to get vaccinated, and there's just no way that the city by ourselves can do all of that. So we'll scale up as much as we can. We'll be ready for when we get more vaccine distributed to us. But it's going to take far more than just the city governments to do this. It's going to take the private sector and the doctor's offices and clinics and everything to help out as well as more vaccine becomes available.
Yeah, Bill, I think that's a great point. I just wanted to mention that I was reading that the way things will get better for vaccine distribution is going to be involving the pharmacies, primary care doctor offices, and private sector, like you mentioned, other establishments that can jump in and say, volunteer that they would like to distribute the vaccine as long as there's no issue with storage. Because with Pfizer, the issue is storage. You have to have a -94 Fahrenheit storage. With Moderna, it's slightly better. With Johnson & Johnson, it's even better because you can store in a common fridge for 3 months. So I think as we get more vaccine distributed to other areas, and not just the city in itself, for the local government, I think there'll be a lot more access to it, and there'll be a lot easier to dispense the vaccine to the people whoever wants it.
Right. And what y'all may not know is the city of Frisco actually has some of those ultra cold storage. So the doses that we got previously was the Pfizer vaccine. So we're set up to distribute that. Obviously, the others become a little bit easier. And to your point, Dr. Duggal, if it becomes more like the flu vaccine, there's going to be a lot of distribution points over time as the supply ramps up and more becomes available.
Rene, one question, like, the same kind of setup is going to continue, like homeschooling, or else in the next academic year? What are your plans?
So we're actually working right now on the virtual academy model for next year. The state has not given us approval to offer virtual instruction from the Frisco ISD level yet. And so all of our legislators are in session right now throughout the spring. And so we will get guidance from them over the next few months as to what we're actually able to offer from a district level. From our perspective, we know that there will still be parents in the district that would like to have their children in a virtual academy type of environment, a virtual learning environment next year. So we want to make sure that the state will allow us to educate those children through Frisco ISD with Frisco ISD teachers, and that they can remain Frisco ISD students. Some of the things that we're hearing right now, there's some talk about having a statewide virtual instruction model. We really want to keep our kids in Frisco, so we are advocating for the state to allow us to continue to offer that virtual model here at home.
All kids have
I just wanted to add.
kids have. Okay, good.
Oh no, I was just going to say that, I think I was reading these new CDC guidelines that came out a few days ago for school reopening in the fall, if that happens, and they have put out a lot of good information on how we can make it happen, and I think that will impact all over the country. What happens, because if the federal government is going with the CDC and recommending schools to reopen if they meet those criteria, and also if we are able to get more information about kids getting vaccinated, I think those two things would play a big role in how we move forward in the next academic year.
I agree, and a big thing for us, the best place for our students are in our classrooms. This virtual model of instruction, while it has been an incredible thing that our teachers have been able to accomplish, we want our students in our classrooms for their mental health, for their academic growth. Students need to be amongst their peers and amongst their teachers. There's so much more that a student learns in school outside of academics, and being able to participate in athletics and fine arts and being with their peers and learning those soft skills, and us being able to focus on their mental health and their safety, and even something as important and also as simple as making sure that our students are eating every day. I mean, we have 8,000 students in Frisco ISD who qualify for free and reduced lunch, and we want to make sure that we're feeding their bodies and their minds, and that's important for us to have them in our schools and on our campus. This virtual model, it works for some kids, and we've seen students thrive in the virtual space, but for most students, the best place for them is in our schools.
With this kind of setup, I mean, there is a lot of lethargy, and kids are actually do not have any physical activity, and they're putting on a lot of weight. I mean,
and more than weight, I think there are a lot of mental problems developing. I think I saw one case where I think some committed suicide. And this is mental health is going to become a pandemic. I think, we will control this virus pretty easily, but mental health is going to be a big problem. At least, from my neurology aspect, I'm seeing already patients, a lot of increase in Xanax prescriptions, antidepressant prescriptions. Patients are getting, they're losing jobs. They have difficulty finding a new job, because of which sudden surge in the number of prescriptions for antidepressant anxieties. So I hope we get this all under control, not just the virus alone.
Yeah, and the city's actually seen an uptick in domestic violence calls and mental health calls over the last year. Measurable, significant increases in those types of calls. So, that's one of the things that we look at too, and that we're cognizant of when we're trying to figure out what's the best direction for the city when you come to opening or closing businesses, because those mental health issues are impacted by some of those decisions that we have to make. So we're very cognizant of that as well. It's one of the reasons, we're also encouraging people to get outside as much as possible, be outdoors. It helps give that mental break so that you're not always cooped up inside.
Yeah, Rene, can you also comment on that piece? Because I think mental health, especially students with the whole lockdown situation, right? So can you comment on that same note, please?
Yeah, I mean, we spent a lot of time in Frisco ISD, pre-pandemic and certainly in the middle of this pandemic, on social and emotional well-being of our students. And we have, social emotional learning is a big part of our curriculum. We focus on the whole child. When we focus on a student, it's not just their academic achievement, it's their safety and well-being, their ability to connect with people, getting them ready to be future ready leaders, either with their careers or in college or the military. So all of that goes into creating the whole child, and all of those components are important for a successful young adult. And that mental health component, like the physicians mentioned and like Bill mentioned, we have seen an uptick in anxiety and in depression. Students are not meant to be idle. They're not meant to be behind a computer screen all day without connection with other people. And, you learn so much outside of academics when you're in a school and you're in a classroom setting. And so, to just be at home all day while, they're safe from, for the most part, they're safe from COVID transmission. There are so many other things that are impacting them that in some cases, especially with what we've seen with kids, their reaction to COVID is not like someone who's 65 years old with underlying, disease that they really can have a really bad luck with this virus and with this disease. But for kids, we're seeing that the depression and anxiety, the mental health issues, those are way more impactful than COVID has been amongst our students. And so, we want our kids to be back on our campuses, back in our classrooms.
So there is one other question, like how safe is travel? Air travel?
Yeah, I think most of the airlines, they have done a really good job of minimizing overcrowding in their planes. And most of the airports, they have very good restrictions on, where you can sit, what you can do. And there's masks available, everybody has to mask up, and there's stations for hand hygiene. So I think they've done a really good job with all that. And right now, if there's urgent travel or emergent travel, obviously there's no problem with that. And as far as like travel for leisure or something like that, I think that depends. If you've had your vaccinations, then it's actually easier to travel because you're less likely to get a severe illness even if you get exposed. But if you haven't had your vaccination, then that's an issue. And I think that would be, you consider, how much of important it is for you to travel, and then you decide based on that.
Thank you.
And also, I think there is a recommendation now about double masking because not everybody is fitted for the vaccine with the mask since they don't use N95. It's a regular mask we are using, and it doesn't cover everything. So, is it advisable to use a double mask, or just it's okay to use single mask?
Yeah, I think there's a lot more information out, and this was a talk on the national telecast as well, and I was listening to Dr. Fauci talk as well. And I think the key here is what they're trying to imply is that the cloth face coverings that people were using at home, for example, the ones they made at home, which had a single layer, or they had a bandana or something that they used to cover their mouth with and nose with and go to public places, that's not acceptable right now. So what they're saying is, either you wear a surgical mask, which is a better quality mask, which you can buy from Amazon or any other place. It should be easily available. Or the next option is to have 2 layers of cloth face covering and put a filter in between to protect yourself from these highly contagious strains that I talked about earlier with the UK strain and the South African strain. And the third option is wearing a KN95 or an N95, which is obviously the best, but not everybody has access to that. So I think the options here are, as I mentioned, and one other option they were recommending is maybe wear a maybe wear a surgical mask first, and then put a cloth face covering on top of it to make a better seal around, so you don't have any issues with the virus getting in from anywhere. And I think these are the strategies they're trying to mitigate the highly contagious strains that we're talking about, which may become the more predominant strains in the next few months.
Same note, quick question on that, right? So probably this could be for both ISD and for city. So I work with Town of Cary, okay? So Town of Cary had a lot of these PPE coming in, and then they had a big pain point of distributing this PPE. So how does this, so let me ask first, Rene, how are you distributing PPE? Is it free, like when you give masks or anything to students? And probably Bill can answer the same question,
So we had an allotment from the TEA when the school year started for PPE, and then we have purchased PPE since that allotment, depleted. And so we're providing it to all of our teachers, and we have it, if our students show up without a mask to school, then we have PPE for them as well. So we have plenty of it. Luckily, it's very different now than it was at the beginning of the school year when we were really trying to find this PPE, and the city worked with us as well to provide PPE when we started the school year. So it's been a huge community effort to be able to get this these resources into the hands of our teachers and students.
Right. And so because of our planning, we actually had sufficient PPE for a couple of months, had supply completely stopped. Our first responders would have had what they needed to last 2 or 3 months, I believe, is what I recall. Since then, the distribution's picked back up, manufacturing's picked back up. We've not had any issues with obtaining what we need for our city employees and staff.
To Dr. Renuka, what do you suggest to bring up the immunity in the residents? Like right now, some are really in trouble, like because of immunity is really lacking in them. So what do you suggest?
In terms of dietary measures or supplements, is what you're saying?
Supplements and dietary measures. Yeah.
So a lot of my patients ask me, what should I take? A lot of them are already taking zinc or vitamin D and things like that. I always want them to take vitamin D every day, at least 2,000 units. Do I ask them necessarily to take zinc? I don't. If they're taking, I don't stop them. If they're taking 25 milligrams of zinc, I'm okay. But I don't want them to overdo zinc. Some of them go off and do 50 or 100 zinc. That's not good because that will displace copper out of the body. Because if you take too much zinc, it'll throw copper out of your system. So there is no other supplement out there which will boost your immune system. Understand that. Exercise is a good way to boost your immune system. I ask them to always walk 30, 45 minutes every day. It's a good thing to do to keep your immune cells strong. Eat healthy. These are the things to keep your immune system. A lot of my patients go on taking elderberry, that supplement. I tell them, don't do all of that. Just you have to walk. You can't just sit in front of a couch and take a bunch of supplements and think that this is going to help you. No, vitamin D is definitely a must. Zinc maybe, because even actually a study came out a couple of days ago that zinc supplements didn't really do a whole lot good. The Dr. Fauci did come on the national television and told them to take something, because taking something is always on a positive note. If you tell just walk every day, exercise, people are not going to do that. But they have to. Walking every day is a must to keep your teeth.
For the vegetarians, like B12 is a must, right?
Vegetarians, B12 is a must. Definitely a sublingual B12 will be a good idea.
Yeah.
But daily walking is a must. Definitely.
Yeah, I think adding to that, the zinc is, people are using 50 milligrams for now close to 8-9 months. And I have seen few patients who are developing neurological complications due to that, because it displaces copper absorption, become copper deficient, which causes exactly same symptoms like B12. They have difficulty walking, they have increased reflexes, balance problems. So it's much more problematic. So if you take zinc just during infection, that's okay, but don't take it for a long period of time. I think, just a regular multivitamin a day is fine. Just take some yogurt or probiotics, immunity, and regular walking, deep breathing exercises. You can just YouTube, expand your lung capacity. And that helps you, if you get sick, that helps you to recover a little bit better, right? Vital capacity. So deep breathing exercises. So I think this is a hacking. Somebody hacked into us. Wow, I just can't imagine that they're able to hack into Zoom call. Sreekanth, I think you can wrap up or delete the user.
There are too many.
Okay, you can wrap up and then you can.
Assim você me mata. Ai, se eu te pego. Ai, ai, se eu te pego. Ai,
Sreekanth, there are too many calls there. Remove it. You can close it.
Maybe mute everybody.
Yeah, I
Can unmute.
yeah, Zoom is not safe. So they're able to hack into us.
Yeah.
So I think, expanding the lung capacity, yogurt, turmeric, walking, just one multivitamin a day. I think that's probably what I would suggest as a general dietary standpoint. What Dr. Basavaraju was telling is that, so don't overdose on certain things, don't take crazy things, and put yourself in.
I think we wrap it up, Sreekanth. I think we wrap it up.
Yeah, sure. So, any other?
Yeah, I think Sreekanth will wrap it up. Yeah. Thank you. Appreciate it.
Thank you.
Yeah, I think we can wrap up, because I think we have at least 90 minutes. Thank you so much, everybody, especially all the doctors, Dr. Sunil, Dr. Duggal, and also Dr. Renuka. And then Rene from Frisco ISD and Bill from City of Frisco. Thank you. So Sreekanth, you can take over and give you a thank you note, please.
Yeah, sure. So thank you all, Rene, Bill, Dr. Renuka Garu, and Anurag Duggal. Thank you very much, Sunil, for
Thank you.
hosting the call.
Thank
you,
you.
Ron.
Thanks, everybody.
Thank you, everyone.
We'll have another